The breast center, we're very proud of our center here in the middle of West Texas because there's some things about the breast center that makes us unique. Number one, we are the only breast center in Texas that has received the 3 highest commendations that a breast center can get. There are other breast centers that give as good care as we do, but their name stands alone and they don't have to prove to the public that they give that quality of care. But we are NAPC, which is the National Accreditation Program for Breast Centers, accredited. We are an NQMBC, which is the National Quality Measures of Breast Centers, Breast Center of Excellence. And we are an ACR, which is American College of Radiology Breast Center of Excellence. So we are a Triple Crown facility showing that we give the same kind of care that you would get if you went to a large center, a big name center. The second thing is that we are very much into personalized care. Like I said, not everybody needs everything, but everybody needs a mammogram. Some people need a screening dense breast ultrasound. Some people need a breast MRI. And we also offer genetic testing here at the breast center, so that if you come up with a genetic mutation, we can even alter your recommendations for that to make sure that does not take you unaware as far as what breast screenings you need. One of the reasons our breast center is so great is we are a comprehensive team. Not only is it here in our imaging center, the breast center, that things take place, but we meet quarterly as a team. Our oncologists from Texas Oncology, our pathologist from Midland Pathology, our breast surgeon who works at Midland Surgical Associates. We all meet as a comprehensive team with other players, nurse navigators, lymphedema therapists, anybody that's going to be involved in the patient's journey to make sure that we are maintaining standards of care and to make sure that if the process can be improved, that we're going to improve it. And so each component of our comprehensive breast team is very, very important. How can we get results to the patient within 24 to 48 hours after a biopsy? Because our pathologists are on board and they're providing those results to us in a timely manner, making sure that our patients are notified of those results. How do we get a patient in with the breast surgeon within 24 to 48 hours? Because the breast surgeon's on our comprehensive team. And so she's making sure that we get those patients in a timely manner. And then we know that the patients are going to get the care that's the standard of care, whether that's radiation oncology or medical oncology at Texas Oncology with those providers, because they also are on our comprehensive breast team. So meeting quarterly, discussing things, improving our processes helps us to continually give the best breast care that's available here in Midland, right in your own driveway, right in your own home. There's a lot of change that happens when you get breast cancer. You have to go to treatments. You have to have a lot of doctor's appointments. But we want to keep as many things as normal as possible. We want you to be able to pull into your own driveway. We want you to be able to sleep in your own bed. We want you to be able to go to your own grocery store. So we want you to be able to keep things as normal as possible. And the way that we can do that and still assure you that you are getting the optimal care is by doing these things like the Comprehensive Breast Committee, by doing these things like having all the accreditations that are available, that people come in and survey us to see what kind of care we're giving and to make sure that the standard of care is being kept.